everybody, it's Dr. Travnicek. Today we're going to talk about pain and exercise. I have many chronic pain patients who are very motivated to exercise. We just have to change how they exercise. These patients are highly motivated and they are always striving to find ways to be physically active. Each patient is going to have different exercise recommendations. I want to talk about pain tolerance and exercise tolerance. Exercise tolerance is the amount of exercise that one can stand before coming breathless and tired and having to stop. In some instances, I have to refer patients to a cardiologist for an exercise tolerance test, such as a stress test. This is a measure of cardiovascular endurance. We talked about exercise tolerance. Let's talk about pain tolerance. Pain tolerance is the amount of pain that you can reasonably handle. You feel pain, but you're also able to tolerate that pain. Some people have a higher pain tolerance, so they can handle more pain than the average individual. This has been tested experimentally, and in general, men, athletes, and people who exercise have higher pain tolerances. So how can one achieve a higher pain tolerance? Exercise, exercise, and exercise. Physical activity, especially aerobic activity, has been shown to increase pain tolerance and reduce pain perception. Studies for chronic pain have shown that patients who swim or cycle at a moderate or more intensity can increase their pain tolerance. The second exercise that increases pain tolerance is yoga. People who regularly practice yoga have been found to have a higher pain tolerance. The last two things that can increase pain tolerance are brain exercises. These include mental imagery and biofeedback. So what affects pain tolerance? Many things can influence the complex communication that your body and mind have. Number one is genetics. Your genes or genetic makeup can affect how you perceive pain. This has been experimentally tested with cold, heat, and pressure modalities. Number two is sex. For unknown reasons, females will report higher pain levels than men do in experimental models. Number three are patients with chronic illness. Patients with fibromyalgia or migraine have been shown to have lower pain tolerances. Number four is mental illness. Studies show that individuals who battle anxiety and depression have more intense pain. Number five is insomnia. If a person experiences insomnia at least once a week, they have a lower pain tolerance than someone who has no problem sleeping. Six is stress. Being under a lot of stress can make pain feel more severe. Seven is past experience. One example of a previous experience that can change your pain tolerance is going to the dentist. If you've had a painful experience at the dentist prior, when you return, the pain may actually feel more because you expect it to happen. And that rolls into number 8, which is expectations. If you expect more pain, you will feel more pain. Some of the things we discussed you cannot modify. Always discuss with a physician before you start an exercise program. Let me know what questions you have in the comments about what we discussed today.